Hi, my name is Patrick. I'm going to be conducting a head-to-toe assessment on you today, and I'm going to be touching you in various places of your body during this assessment if I have your consent to do so. Okay, I'm going to perform hand hygiene, provide privacy for my patient, and then I ask for your name and birthday.
John Collins, 5/28/97.
Okay, and then I'll verify that on your wristband. That is the correct patient. Can you tell me where you are?
Southern West Virginia Community College.
Okay, can you tell me what day of the week it is?
Monday.
Okay, patient is oriented to person, place, and time. So he is oriented ×3. Can you wiggle your fingers for me? And I will give him a 15 out of 15 on the Glasgow Coma scale. He is dressed appropriate for the occasion, sitting erect, willing to participate, clean, kempt, and dressed appropriate for his age. So I will start by assessing your cranial nerves, 1 through 12. So I'm just going to have you close your eyes and place something under your nose, and then I need you to identify the smell for me.
Peanut butter.
Okay, patient was able to identify that was the smell of peanut butter. So cranial nerve 1's intact. So now I'm just going to step back here, hold up my fingers. I need you to tell me how many I'm holding up.
3.
Okay, patient was able to identify that I was holding up 3 fingers, so cranial nerve 2 is intact. Cranial nerves 3, 4, and 6. I just need you to follow my pen line. Okay. Now I am going to have you stare off at an item on the wall, and I'm going to shine the light in your eyes to see if your pupils constrict. Okay, patient's pupils were originally at a 4, constricted down to a 3 consensually. His pupils are equal, round, reactive to light, and accommodation. So cranial nerves 3, 4, and 6 are intact. Now I'm just going to have you close your eyes. I'm going to touch your face with this cotton ball. I just need you to tell me when I'm touching your face. Okay. Patient was able to identify every time I touched his face with the cotton ball, so cranial nerve 5 is intact. For cranial nerve 7, I am going to have you bite down for me. Okay. Master muscles are flexed. Can you smile? Frown, puff out your cheeks, and raise your eyebrows. All right, cranial nerve 7 is intact. For cranial nerve 8, which is your ears, I am going to have you cover one ear, and then I'm going to whisper something in the opposite, and I need you to tell me what I say.
ABC.
Okay, now we're going to the other ear.
1, 2, 3.
Okay, cranial nerve 8 is intact. For cranial nerves 9, 10, and 12, I'm going to have you stick out your tongue and say ah. His uvula is rising midline. Can I have you stick out your tongue and move it around for me? Okay. Patient was able to move the tongue. The uvula moved. Cranial nerves 9, 10, and 12 are intact. So for cranial nerve 11, I'm just going to press down on your shoulders. I need you to shrug against my hands for me. Okay. Cranial nerve 11 is intact. Now, starting the actual physical head-to-toe assessment, I am going to inspect his head for symmetry, shape, ensure that his skin color is appropriate for his ethnicity, and that his head is normocephalic. Hair is distributed evenly, which it is, with no lumps, bumps, lesions, or infestations. And I will palpate for tenderness, so just let me know if you have any pain here. Okay. Now I will move on to the patient's mouth. So can you open your mouth and say ah for me again? Stick out your tongue a little. Say ah. Okay, his tonsils are at a 1+. His buccal mucosa is pink. He has no missing teeth. Can you peel your lip down for me a little bit? Gums are pink, moist. His lips are free of cracks and moist as well. Now I will inspect the nose. Can you look up? Okay. Septum is not deviated. Patient's nose is free of any obstructions, and his he has no drainage in his nose. Now I'm gonna palpate your nose and your sinuses, okay? Any pain or tenderness? Okay, so now we'll do the sinuses. What about here? Here? Okay, so no pain upon palpation of the nose was absolutely an expected finding. Now we're gonna do the ears, so I'll inspect those with the pen light as well. And they are free of excess earwax, no drainage, no obstructions, no infestations in either ear. Now I'm gonna palpate your ears for pain. Any pain? Okay. So now I will do the eyes. The sclera is white, and I will take your conjunctiva here. Conjunctiva is pink and moist. Now I'll palpate the outer surfaces of the eye. Any pain? Okay. So the eyes are good. Now I'll take a step back and look at the patient's neck. His trachea is midline. His hair is evenly distributed. No lumps or lesions, bruises, or anything like that. And at this point, I would raise the bed into a Fowler's position, have the patient turn his head to either side, and ensure that his jugular vein is not distending to check for JVD. So now I'm going to palpate your lymph nodes. So I'll start up here at the preocular. Any pain? Here? Occipital, any pain? Okay. Submandibular, submental, cervical chain. Here? Okay. About here. Okay. So no pain or tenderness in the lymph nodes. Now I'll palpate his thyroid gland. Any pain here? Okay. Thyroid gland is non-palpable and free of any pain. So that is an expected finding as well. Now I will move, I'm gonna palpate his carotid artery and his temporal artery, and then auscultate those as well. So both pulses in the carotid arteries are 2+. Temporal arteries are 2+ as well. So now I'm going to auscultate those for any bruise. No bruise noted in the temporal or carotid arteries. So now I will do a chest and lung assessment. So I am going to inspect and ensure that his chest is symmetrical. His skin is appropriate for his ethnicity. His hair is evenly distributed. And then I will palpate his chest for pain. So if you just, any pain? Okay, now I'll do the lateral chest. Nothing there? Okay, now I'll do the posterior chest. No pain? Okay. So now I will palpate for tactile firmness. So I'm gonna place my hands on you. Every time you feel my hands move, just say 99, okay?
99, 99, 99, 99,
Now we'll do the lateral.
99,
Okay, we'll do it on the posterior side now.
99, 99, 99, 99, 99.
Okay, tactile firmness is present in all lung fields. So now I'm going to percuss your lungs. So I'm just gonna tap my fingers here, okay? Okay, resonance is heard across all lung fields. Now I'm going to auscultate for breath sounds. So every time you feel my stethoscope, just take a deep breath with me, okay? Okay. Lung sounds were clear with no signs of wheezing, crackling, or adventitious breath sounds in the anterior, posterior, and lateral chest. Now I'll move on to the assessment of your heart. So what I'm going to do is palpate for any lifts, heaves, and thrills, and then palpate your apical pulse. So no lifts, heaves, or thrills noted, and I was able to find his apical pulse. So now I am going to auscultate for valve sounds, and then I will auscultate his apical pulse. So we're at the pulmon, aortic, pulmonic, tricuspid, and mitral. Patient had clear S1 and S2 sounds with no S3 or S4 sounds, which is an expected finding. S1 was heard loudest at the apex of the heart, and S2 was heard loudest at the base of the heart. Now I will assess the patient's apical pulse for a full minute. Patient has an apical pulse rate of 74 with a consistent or regular rate and rhythm. So now I am going to go back up and assess you for hearing loss and do a range of motion and strength test in your neck, because I did not do that while I was up in the head. So first I'm going to do a Rennie test. So I'm going to strike the tuning fork, place it behind your ear, and then outside of your ear. I just need you to let me know which one is louder.
Air.
Okay, we'll do the other side.
Air.
Okay, now I will do a Weber test. I'm going to strike the tuning fork, place it on top of your head, and I just need you to let me know right here. Can you hear it in both ears? Mm-hmm. Okay, so patient has no hearing loss in either ear. Now I will do range of motion on the patient's neck. So I need you to just move your head a circle for me, forward, and look up. And now press against my hand. This side as well. Patient has full range of motion in the neck and his muscle strength is at a 5+. Now we will do the upper extremities. So I'll have you hold your arms out for me. And now I'm gonna inspect his skin to ensure that his color is appropriate for his ethnicity. His hair is evenly distributed. His capillary refill is less than 2 seconds, which is a normal finding. And I will check his skin turgor. And it is elastic. I'm going to do that on your chest as well. And it's elastic there as well. So now I'm going to assess his radial pulses, which are a 2+, and I'll palpate those lymph nodes. Any pain? Okay. So no pain upon palpation of the lymph nodes in the upper extremities. Can you stand up for me? And hold your arms out to the side. Make a circle. And flex your elbows. And move your wrists in a circle. So full range of motion in the upper extremities. You can sit back down. Now I will move on to the patient's abdomen. Can you lay back for me? And lift your shirt up if you don't mind. Now I'm going to inspect the shape and symmetry of his abdomen, which is slightly concave and flat. I'm going to ensure that the apical or the aortic impulse in his abdomen, which is non-visible, and I will ensure that his chest and abdomen is symmetrical, which it is. And then I'm going to auscultate his abdominal aorta and auscultate his bowels. So I'll start with the aorta. Scoot your hands up for me. Abdominal aorta sounds present, and now I will auscultate the bowels. Patient has active bowel sounds in all 4 quadrants. Now I'm going to do palpation of the abdomen. So I'm going to palpate for that abdominal aorta. Now. It is non-palpable. So I'm going to do light palpation of your bowels in all 4 quadrants, and then I'll do deep palpation. Just let me know if there's any pain. Okay, I'm going to do deep palpation now. Okay, patient has no pain in the abdomen upon palpation. So you can sit up for me. And now we will do your lower extremities. So I'm going to inspect the lower extremities, ensure that his hair is evenly distributed, his skin is appropriate for his ethnicity, and I would inspect the capillary refill in his feet, and if he didn't have socks on, and ensure that his capillaries refilled within 1.5 seconds or less. And now I will palpate all your pulses and palpate for edema. So I'll start with edema. Patient shows no pitting edema, and now I'm going to do the pulses. So the popliteal pulse is at a 2+. The post-tibial pulse is at a 2+. And his dorsalis pedis pulse is also at a 2+. Now, if you could stand for me. Patient's thorax is at a 2-to-1 transverse to AP ratio. Now, if you could take a step forward. kick out one of your legs, either one, it don't matter. Go to the side, back, and now the opposite leg to the front, side, and back. Okay, full range of motion in the lower extremities. Could you sit down for me? I'm gonna do muscle strength on your legs as well. Just push up against my hands. Down. Now flex your feet. And down. Okay. Muscle strength is at a 5+ in the lower extremities, and yeah, you can stand for me again. Take a step forward. Close your eyes with your feet together. I'm just gonna have you stand there for 30 seconds. Okay, the patient was able to stand with his feet together and eyes closed for 30 seconds with minimal swaying, so the patient passed the Romberg test. So now if you could just walk over to the camera and then walk back heel to toe for me. Okay, patient is showing steady gait with balance as well. Can you hold your arms out and close your eyes and touch your nose with your index finger? Now the opposite hand, and then do it one more time with each hand. Okay, cerebellar function is good in the upper extremities. Now can you take your heel and run it down the opposite shin? Okay, do the opposite leg now. Cerebellar function is good in the lower extremities. Okay, if I can just have you to sit back down on the bed for me. And close your eyes. Hold out your hand, and I'm gonna hand you something. I need you to tell me what it is.
Cube.
Okay. Patient passed the diagnosis test. Now we are gonna assess his deep tendon reflexes. So I'm just gonna tap you with this hammer here. Okay, there we go. Deep tendon reflexes are present. Now I'm going to do a WWCTC test, so I'm just going to hold out your leg and, okay. WWCTC reflex is present. Do you have any questions for me? Okay, that concludes our head to toe assessment.